welcome back to Rohrichknose podcast, helping you become a better and more informed you. And by popular demand, we have Bita Farrell back. As you know, she's been on several of my podcasts, and she's an amazing educator, an amazing injector. She's got an incredible background. She's an anesthesiologist at at UCLA, and now she does an amazing. She does a lot of injections in LA, and she's a great teacher. So, Bita, welcome back.
Thanks for having me back, Rod.
Good.
Very nice to be back.
That's great. It's great. And so tell us a little bit about what you're doing. You know, last time we talked a lot about safety and the use of ultrasound, but today let's talk about a hot topic that actually is, you know, certainly as a plastic surgeon and as somebody that does a lot of facelifts, you know, do fillers really interfere with facelifts and especially the biostimulators? So give me your thoughts, and then I'll obviously tell you my experience and expertise in this since I do this every day. And by the way, I hardly ever see a virgin facelift anymore because it's just how it is. I mean, patients have had Botox, they've had fillers, they've had sculpture, they've had radius, I mean, and then they've had radio frequency, ultrotherapy, they've had everything. So when I just had one a couple of days ago that was like, and I was telling my fellows, wow, this is a virgin facelift. I mean, because it just was amazing because it was so easy compared to, you know, having some of these other things. So Bita, tell us what you tell your patients and give us your experience with the biostimulators and tell us what they are.
Exactly. I mean, that's exactly why I wanted to speak to you and, you know, the ultimate expert about this, because I have had, you know, yes, women don't straight jump into a facelift. They usually get Botox, fillers, and/or biostimulators, and then when it, you know, when at certain point when those results are not adequate, then they go to surgery, and some things cannot actually be treated with just Botox and fillers when it's gotten to a moderate, you know, degree of laxity. So, and I have had some feedback from, you know, patients coming back and saying, you know, I went and had a consultation, and the plastic surgeon said that because I have had fillers and or biostimulator, it may be a challenge to do my surgery. So I asked a few colleagues around town, and I really wanted to bring light to it with you and see what your thoughts are. So biostimulators are, you know, either Sculptra or Radius. And, you know, I like Radius more because it doesn't cause that inflammatory process. And it's a more of a hybrid biostimulator / filler. But, you know, I've heard that some surgeons don't like it in the face, especially before within a year of having a facelift.
I think I agree with you. You know, biostimulators are obviously they induce collagenesis, and Sculptra. I mean, it's a great. These are all great, you know, FDA approved products, but it's an inflammatory process, so it actually causes a little bit more diffusion of the scar plane of the tissue planes, and that's really, as a surgeon, when you get in there and your tissue planes are distorted, then it's more of an issue. But I see it a little bit more with Sculptra than with Radius, so you're right about that. And but I mean, it's good to stop it, like we talked. It's good to stop it about a year before. That's a good thing to tell your patients. And by the way, whoever said that, you know, like I said, there's no such thing as a virgin facelift anymore. So everybody has fillers, neuromodulators, radiotherapy, radio frequency therapy, and all therapy. Everybody does that. So that's just a normal thing today. So if they're a plastic surgeon in LA or in Dallas, or, I mean, that's just part of life. And you know, because people don't just like magically come up at age 50 and say, I want a facelift. They'll have done other things, you know, like you mentioned, like they've seen you for years. But to be prudent, like you said, you know, I think try and injecting it in the right plane and actually, you know, not being aggressive and doing too much. But really, a year between it really helps me a lot because, you know, if it's been more than a year with both Sculptra and Radius, it actually has softened it so that I can get to the tissue plane better. But and also, it just makes my job a little harder, but I think the end result can be very much similar. But it does make it harder, so I agree with that, but yeah. I don't think it should compromise the result, unless it's really something that's outrageous.
And my advice to them is if you're going to go get a consultation with a plastic surgeon in the next month or 3 months, then let's not do anything, because it's nice for you guys to see their face as fresh canvas as can be. And also, especially even with, Botox, Botox can alter the face, especially the upper face with bleps and stuff. So I always tell them, if you're really thinking about getting plastic surgery within the next year, it's best to hold up getting biostimulators and fillers. But I think Botox is fine. But, a lot of women first go the injection, and men go through the injection route, trying to do something minimally invasive or non-invasive. And then when they see that the results are not what they want, then they go to surgery.
Yeah, and that's normal.
So,
that's normal. I mean, it's not just
Yeah.
it's normal. And so for people to say you shouldn't do them, of course, this is not going to happen. And I think the key is to inject it in the right plane. And certainly you're an excellent injector, so you inject it in the right plane. If it's really been like bulked or bolused, and of course that's a scar tissue plane. But in the hands of great injectors like you, Bita. And I can tell that, if they've had it done in a spa or something like that, I mean, then, I sometimes see these boluses and they're like nodules. I mean, that's crazy. But I think the biggest thing is to less is more, inject it in the right plane. And then the other thing is, when you start seeing jowls, you need to back off on fillers and everything else. Because once you have jowls, then you start trying to follow that, and then you get the pillow face. And then
Right.
It's a disaster. Those are the patients that are hard because they're overfilled, overdone. And, we have all those examples, in Hollywood and LA and Dallas too,
Yeah. And I think we are moving away from that. I think their culture is shifting where people are moving away from the big lips and the big cheeks, and people really do want to look a little bit more natural. And that's where these biostimulators are wonderful because, like I said, they're a hybrid. They not only tighten skin a little bit, they add just like a more global volume to the face, and they don't just put focal big chunks of, boluses of filler here or in the lips or the chin to give that cartoon character. So we are actually doing more and more biostimulators. People are shifting to doing more of that. Right. And patients are loving it because it gives a very natural looking result and something that lasts much longer than fillers.
Yep.
So, and so that's why, but now we have to think about it, and yes, I agree with you. If somebody has any degree of jowls that's beyond mild, no amount of Botox filler is going to do this. So people come and say, I want to look like this, and I immediately tell them that's surgery.
Right, exactly. Fillers fill, they don't lift, and that's why they're called fillers. And there's several things that happen. One is, the Kardashians have finally found out that it's time to not do so much filling, and that fillers last a lot longer than we think, and you can't necessarily melt them. And there's been some studies to show that they can even cause lymphatic obstruction, especially if they're overdone in the tear trough. So people are kind of backing off on that, and I think that's good. And also, it's making people hesitate because, you shouldn't get your fillers like you do your Botox. You need to take it easy, and less is more. And so I think that, along with understanding that, that HA fillers aren't necessarily reversible, and also there's an advent of natural, using natural fillers or using, PDGF, platelet-derived growth factors, and I think that is the new horizon. There's new FDA-approved platelet-derived growth factor, which is Ariescence, which is phenomenal. And so you could actually, in the office, inject, platelet-derived growth factor, and I think you can micropin it. You can, I think all these things are on the horizon, which actually I think are better, especially for the tear trough.
Yeah, and there's so many new things like the polynucleotides, which we don't really have. It's not FDA approved, and we don't have access to inject yet. But they're using it in Europe and Korea, and they're seeing great results. I mean, I'd like to try it once it actually becomes FDA approved. But you're right, we are moving away from these hyaluronic acid fillers. People just don't like the way they look anymore, and the migration. And you're right, that study that came out with the lymphatic obstruction that then got extrapolated to maybe causing cancer, that was a big big to do.
Yeah, no, I know. Well, no, they don't cause cancer, but they can cause
No, they
lymphatic
don't.
obstruction.
No.
I think it's also injecting in the wrong place and too much. That's why you kind of know before you go. You know, you find a good injector. You find somebody that's competent, that shows good results, that teaches people like you do, that actually is very honest and really is all about safety. And I mean, kind of those are the know before you go. So why don't you share with the viewers, you know, your perspective on the things they should do. And I liked what you said, you know, stop a year before. Neuromodulators, I think 3 months is good. And also to, you know, just do it appropriately. And I know you inject it in the right place because you use ultrasound a lot, especially in the danger zones areas. So share with your experience.
So I think the most important thing is actually patient selection, because I think a lot of people, you know, there are a lot of wonderful injectors out there. It's just, who are you going to do the procedure on? It's one thing to learn to do the procedure in that, you know, with the right products and the right plane, but who are you going to do it on? So the consultation is a very important part, and actually meeting the patients, getting to know them and understanding their expectations and what they think is going to, what degree of improvement this is going to give them. So that's one thing. And if once they, you know, and again, like I said, if they're come in and say, I want to look like this, and you know, I immediately tell them that's surgery, or you know, they pull their neck back, surgery. But once the expectations are agreed on, then I think I always tell them, you know, I always say, you know, there's a place for each product, and I tell them what you said. I said, no amount of filler is going to lift the jowls or lift the face. They can give an optical illusion, and they can camouflage and shift the volume to a different area so light shines on it, but nothing is going to actually lift. No amount of filler is going to lift something. But biostimulators, I always, you know, and I always say, like, fillers are there to fill lost volume, and we should replace volume that's been lost, not just add volume to try and lift something. When it comes to biostimulators, then I tell them, well, that's a whole different category that adds volume over time. It also helps, I think Radius is a wonderful skin booster. It definitely has been shown to increase collagen, elastin, which over time increase the tone of the skin. They tighten a little bit, but again, not pull back, but they definitely increase the tone of the skin. And then they also do add some volume, because as you build collagen, you do increase some volume. And then with Botox, I always tell them that, again, Botox is very temporary, and it is just used to relax the muscles that have over time create this memory of and created a line. So once you set those expectations, and it takes time to talk to people, it's nice to just see someone and start injecting, but you really have to get to know them and develop a relationship and see even if they're fit. And I turn a lot of people away because I tell them, what you're thinking this is going to do is not going to do. So, and again, always bring up, like, are you thinking about getting, and I tell them yours are moderate now. Would you, if you're thinking about surgery in the future, maybe that's the route you should go, because this is just a little bridge that will get you there. And while we're on the topic, like, I just want to throw in threads. I am not a fan of threads. I think that no little suture is going to lift up heavy gels. So I am just, it's very, I just think it's a very temporary swollen effect. So again, I just educate them a lot, but I think the role of biostimulators is expanding. And like you said, the other wonderful products that are coming to the industry too.
That's right. Well, wise words from Dr. Bita Farrell, an excellent injector in LA. She's really prudent. You can hear it, and she's all about patient safety. So please follow her on Instagram, and if you're in LA, she's the one to see. All right, helping you become a better you. And if you like this, you're going to love the other podcasts I've done with Dr. Farrell on patient safety and ultrasound therapy, also ultrasound-guided safety for both neuromodulators and fillers. Till next time, stay safe.